let's get you a consult and an appointment date for a corticosteroid shot so that you can remove that initial barrier of pain to get back to work. Like one comes to mind for a gentleman who had a job where he was lifting overhead, couldn't do it at all, and nothing was going to work with him within the next 72 hours. Like that was just the nature of his diagnosis. And it's just like, look, we could try and just do this quote unquote correctly, which is conservative care, get you back what you're doing, and it's just going to take time. But he was in such an amount of pain that he would have had to have taken off work, used up all of his vacation days, and then some, not getting paid for that amount of time. And he was not in a position to be able to do that. So we had the conversation of, all right, let's get you a consult and an appointment date for a corticosteroid shot so that you can remove that initial barrier of pain to get back to work. All the while, you are also then going to be working with me, and we're going to monitor you over an extra couple of months just to make sure that nothing comes back, because now we're rehabbing through a lot less. There's a lot less breaks on his rehab, so some people will get a little bit, how do I phrase this? The two common pitfalls when it comes to rehab is that you either go too slow for too long or too fast too quickly. And when you have a corticosteroid shot, it is very difficult to dial that in accurately for your patient, because on the one hand, you understand they have a corticosteroid shot and you don't want to move very fast at all because they have no, like if it works, they have no pain. But at the same time, they have no pain. So you may just all of a sudden go gung-ho, get them all the way to do 110% of what that joint or muscle could have done in the first place. And then when the shot wears off, they may start feeling worse for wear. So that's why when I talk with my patients, I'm just realistic. It's like, all right, the shot's going to do what the shot's going to do. We're going to do what we normally do during this process, and we're going to rely very, very heavily on more objective metrics. So in my office, we have muscle testers with dynamometers, and we're actually getting a set of force plates so we can assess how the body is actually inputting force into the system. And we're going to rely really heavily on those metrics while you have the shot, and make sure that we're monitoring you past that 6-week mark at the very least, if not into the couple of month mark, just to make sure that our objective tests are progressing in the right direction, and then your symptoms do not return twofold now that the corticosteroid is wearing off. So just food for thought when you're considering corticosteroids.